Hi everyone, it's Dr. Jeff here today. Today we're talking about something called kin tape. It's becoming very popular. A longer name for it is Kinesiology Tape. Actually here at Goldsworthy Wellness Center we use something called rock tape. It's very similar, just I find it has a little bit better adhesive to it, lasts a little longer. The idea behind kin tape is it's a sports tape. It's not a support tape. It's not there to tape up your ankle so it can't move. It's a sports tape that allows movement. It's come out a number of years ago and it's a stretchy tape. And what they find is that when you put this tape on, it does two things. One is it kind of lifts the skin away from the tissues underneath. That allows the fluids and the swelling to flow better, to drain better underneath the tape. The other thing it does, it has a kinesthetic property. And that is, it's a feeling property. So when you hurt your knee or something and you pinch yourself, you feel you pinch more than you feel your knee. And that's the same thing with kin tape. It kind of does something to the skin to allow the brain to forget about the pain that's going on underneath it. My first introduction to rock tape or kin tape was a few years ago when I actually fell off a ladder and I was going to the seminar on rock taping. We put the rock tape on my arm and we found that after 3 days when I took the tape off, the bruising actually disappeared underneath the rock tape, but where the rock tape wasn't, I was still all black and blue and yellow. So it really did a good job at clearing my bruising up and allowing those tissues to flow better underneath. So that was my first impression as to what rock tape does. So it does really help with swellings and movement. With rock tape, you can leave it on for 3 to 5 days, even 7 days. Usually you leave it on until it comes off. You can shower with it on. If you have any creams, such as Traumeal or Voltaren, and you want to rub it on, it gets absorbed right through the cloth material and the rock tape. It's a very popular thing that's going on out there. It's very easy to apply. I'm going to get Brenda to help us out here in a minute to show you how we can apply it to an Achilles tendonitis. So for putting on some kin tape, we've got Brenda here with us today. She's suffering from some Achilles tendonitis, very tender in here, kind of sore through here. So when you're getting the kin tape up, it's a movement stretchy tape. So what you want to do is see how long the tape you need. So going down, just getting an idea of how long you need, and clip it off, and then again I'm going to put another anchor here and an anchor up here. So get an idea. And cut the tape with a nice sharp piece of scissors. I've already done that actually. I've got some pieces here already cut up. So the tape basically rips off. And what I'm going to do is I'm going to get her just to flex her foot here for me because it's a flexible tape. So I'm going to put the tape on the bottom of her foot here. And you don't want to stretch the bottom part. The bottom part stays unstretched. But once you get to the middle of the tape, we can stretch this up to 50% of the way. So we get up here. So we can stretch the tape up, keep that foot flexed. We're going on the Achilles. I'm just going to run this up. And then when we get to the end, take the stress off so there's no stress on the end. We're going to run that down her Achilles like this. All right, nice and smooth. All right, then we can put some cross ones on. So again, we just rip the tape up like this. Okay, we're going to put this in the middle. And again, the middle one we stretch. So you can put that on, you stretch it. All right, get to the end, no stretch. All right. Likewise here, a little bit of stretch. All right, get to the end, there's no stretch. All right, again, put that on nice and smooth, there's no wrinkles. Then what we're going to do is going to put a cross one up in here. So again, nice, you tear the tape. All right, we're going to put this on. And again, we stretch the middle, but when we get to the end, take the stress off. And again, put that on. Likewise, tape off here, stretch the middle. Up to 50%, then no stretch on the end. All right, nice and smooth. All right, and that's what we do with it. So her foot will actually move up and down. We don't lose any range of motion with that at all. This is a sports tape. All it's going to do is try and stabilize the area. That's your kin tape. Well, that's our talk on kin tape. If you have any questions or anything about kin tape or rock tape, you can always contact us here at goldsworthywellness.com. I'm Dr. Jeff, and I've got you back.